Phlebotomy practice questions explained. Question 1. In a clinical laboratory setting, which documentation is most important when a specimen is collected late for a timed test? Option A. The phlebotomist's lunch time. Option B. The actual collection time. Option C. The patient's room temperature. Option D. The brand of gloves used. The correct answer is option B. Actual collection time. Timed test interpretation depends on the actual collection time, so it must be documented accurately. Personal schedules, glove brands, and room temperature are not the key timing information for most timed blood tests. Question 2. Which action is most appropriate when the requisition and patient ID band do not match? Option A. Use the requisition because it came from the provider. Option B. Ask the roommate to confirm the patient's name. Option C. Stop and resolve the discrepancy before collecting. Option D. Collect the specimen and correct the label later. The correct answer is option C. Stop and resolve the discrepancy before collecting. Discrepant identifiers must be resolved before collection to prevent wrong patient testing. Collecting first, choosing one source, or relying on a roommate creates serious identification risk. Question 3. Which practice best supports HIPAA compliance in a phlebotomy area? Option A. Share lab results with a visitor who asks politely. Option B. Leave requisitions face up on a public counter. Option C. Call out full diagnoses in the waiting room. Option D. Discuss patient information only with authorized personnel. The correct answer is option D. Discuss patient information only with authorized personnel. HIPAA requires limiting protected health information to authorized use and disclosure. Public discussion, exposed paperwork, and sharing results with unauthorized visitors can violate confidentiality. Question 4. Which action is best if blood flow stops during an evacuated tube draw? Option A. Check needle position gently and try a new tube if needed. Option B. Probe deeply in multiple directions. Option C. Remove the stopper and pour blood into the tube. Option D. Ask the patient to bend the arm tightly. The correct answer is option A. Check needle position gently and try a new tube if needed. Loss of flow can result from needle position or tube vacuum failure, and gentle correction or a new tube may resolve it. Deep probing, pouring blood, or bending the arm can injure the patient or compromise the specimen. Question 5. Which action is appropriate if the phlebotomist cannot obtain blood after 2 attempts? Option A. Continue unlimited attempts until successful. Option B. Follow facility policy for maximum attempts and seek assistance. Option C. Ask the patient to collect the blood themselves. Option D. Switch to an artery without authorization. The correct answer is option B. Follow facility policy for maximum attempts and seek assistance. Limiting attempts protects the patient and ensures another qualified person can assist when needed. Unlimited attempts, unauthorized arterial collection, or patient self-collection are unsafe and outside routine practice. Question 6. Which patient position is safest for a person with a history of fainting during blood draws? Option A. Sitting on a rolling stool without arm support. Option B. Walking slowly during collection. Option C. Lying down or seated in a secure reclining chair. Option D. Standing beside the collection chair. The correct answer is option C. Lying down or seated in a secure reclining chair. A reclined or secure seated position reduces injury risk if syncope occurs. Standing, unsupported sitting, or moving during collection increases fall and needle injury risk. Question 7. Which step helps prevent hemolysis during specimen collection? Option A. Force blood from a syringe through the needle into a tube. Option B. Draw through a hematoma to access blood faster. Option C. Shake tubes vigorously after collection. Option D. Use a properly sized needle and gentle tube handling. The correct answer is option D. Use a properly sized needle and gentle tube handling. Proper needle size and gentle inversions reduce red blood cell damage during and after collection. Vigorous shaking, drawing through compromised tissue, and forcing blood through a needle can rupture cells and cause hemolysis. Question 8. In a clinical laboratory setting, which action is appropriate when a tube loses vacuum before filling adequately? Option A. Use a new tube of the correct type. Option B. Push the stopper farther into the tube. Option C. Squeeze the patient's arm repeatedly until it fills. Option D. Pour blood from another tube into it. The correct answer is option A. Use a new tube of the correct type. A tube with inadequate vacuum may not fill to the proper volume and should be replaced. Manipulating the stopper, excessive pumping, or transferring blood between tubes can compromise specimen quality and safety. Question 9. Which situation requires immediate hand hygiene after glove removal? Option A. Only after visible blood is on the gloves. Option B. After completing a venipuncture and removing gloves. Option C. Only when sterile gloves were used. Option D. Only before the first patient of the day. The correct answer is option B. After completing a venipuncture and removing gloves. Hand hygiene after glove removal reduces transmission risk because gloves can have defects or contaminate hands during removal. Waiting for visible blood, doing it only once daily, or limiting it to sterile gloves does not meet infection control expectations. Question 10. Which specimen is most likely to be rejected by the laboratory? Option A. Additive tube gently inverted after collection. Option B. Specimen transported according to policy. Option C. The unlabeled tube. Option D. A properly labeled tube collected at bedside. The correct answer is option C. Unlabeled tube. An unlabeled specimen cannot be reliably linked to the patient and is commonly rejected. Correct labeling, mixing, and transport support specimen acceptability rather than rejection. Question 11. Which action is correct when transporting specimens in a facility? Option A. Store all specimens on a sunny windowsill until pickup. Option B. Place requisitions inside the same pouch as uncapped tubes. Option C. Carry tubes loosely in a lab coat pocket. Option D. Place specimens in approved leak-resistant biohazard transport bags. The correct answer is option D. Place specimens in approved leak-resistant biohazard transport bags. Approved transport bags reduce leakage and exposure risk during movement to the laboratory. Loose carrying, poor separation of paperwork, and sunlight exposure create safety and quality problems. Question 12. Which post-puncture instruction is most important after an accidental arterial puncture? Option A. Apply firm pressure for a longer period and report according to policy. Option B. Apply a loose bandage only. Option C. Ask the patient to bend the arm sharply. Option D. Send the patient away without observation. The correct answer is option A. Apply firm pressure for a longer period and report according to policy. Arterial puncture can bleed more significantly, so firm prolonged pressure and proper reporting are necessary. Loose bandaging, arm bending, or no observation can increase bleeding and complication risk. Question 13. Which situation is an example of an acceptable reason to recollect a specimen? Option A. The label was written neatly. Option B. The tube is clotted when an anticoagulated specimen is required. Option C. The tube was inverted according to instructions. Option D. The specimen was collected from the correct patient. The correct answer is option B. The tube is clotted when an anticoagulated specimen is required. A clotted anticoagulated specimen may be unsuitable because the test requires unclotted blood. Neat labeling, correct patient collection, and proper mixing are acceptable practices and do not require recollection. Question 14. Which action is most appropriate for a patient with needle anxiety? Option A. Show the needle repeatedly to prepare them. Option B. Rush the draw without speaking. Option C. Use calm communication and explain each step briefly. Option D. Tell the patient there is no reason to be afraid. The correct answer is option C. Use calm communication and explain each step briefly. Calm explanation and respectful communication can reduce anxiety and improve cooperation. Dismissing fear, repeatedly showing the needle, or rushing may increase distress and reduce trust. Question 15. In a clinical laboratory setting, which information should the phlebotomist verify before a timed medication level? Option A. The color of the collection chair. Option B. Insurance authorization number. Option C. Patient's preferred breakfast food. Option D. Dose time and ordered collection time. The correct answer is option D. Dose time and ordered collection time. Medication level interpretation depends on accurate relationship between dose timing and specimen timing. Food preference, insurance details, and chair color do not establish correct timing for drug monitoring. Question 16. Which tube is commonly used for plasma chemistry testing when heparin is the additive? Option A, green top tube. Option B, lavender top tube. Option C, light blue top tube. Option D, gray top tube. The correct answer is option A, green top tube. Green top tubes commonly contain heparin and are used for many plasma chemistry tests. Lavender contains EDTA, light blue contains citrate, and gray contains fluoride with an anticoagulant. Question 17. Which capillary collection site is generally appropriate for an infant younger than 1 year? Option A, center of the infant's heel. Option B, medial or lateral plantar surface of the heel. Option C, arch of the foot. Option D, a finger pad of the index finger. The correct answer is option B, medial or lateral plantar surface of the heel. The medial or lateral plantar heel surface helps avoid injury to bone and nerves in infants. The center heel, index finger, and arch increase risk of tissue, bone, or nerve injury. Question 18. Why is the first drop of capillary blood often wiped away for many tests? Option A. It contains only plasma and no cells. Option B. It prevents the need to identify the patient. Option C. It may contain tissue fluid that can dilute the specimen. Option D. It is always sterile and unusable. The correct answer is option C. It may contain tissue fluid that can dilute the specimen. The first drop can be contaminated with tissue fluid or debris, so many procedures require wiping it away. It is not considered automatically sterile, it does contain blood cells, and patient identification is still required. Question 19. Which collection error can cause a blood culture contamination false positive? Option A, transporting bottles promptly. Option B, collecting cultures before additive tubes. Option C, using the correct bottle volume. Option D, poor skin antisepsis before collection. The correct answer is option D, poor skin antisepsis before collection. Poor antisepsis allows skin organisms to enter the culture bottle and grow falsely. Correct volume, proper order, and prompt transport help culture quality rather than causing contamination. Question 20. Which tube is commonly used for ESR testing by the Westergren method in many settings? Option A, black top tube. Option B, gray top tube. Option C, orange top tube. Option D, pink top tube. The correct answer is option A, black top tube. Black top tubes contain sodium citrate for erythrocyte sedimentation rate testing in many collection systems. Gray, orange, and pink tubes are associated with different additives or testing purposes. Question 21. Which specimen handling step is important for ammonia testing in many facilities? Option A, allow the specimen to clot for 2 hours at room temperature. Option B, place the specimen on ice and transport promptly when required by protocol. Option C, store the specimen in direct sunlight. Option D, shake the specimen vigorously before transport. The correct answer is option B, place the specimen on ice and transport promptly when required by protocol. Ammonia is unstable, so many protocols require rapid chilling and prompt processing to preserve accuracy. Delayed clotting, vigorous shaking, and sunlight exposure can compromise specimen integrity. Question 22. In a clinical laboratory setting, which action helps prevent needle stick injuries after venipuncture? Option A, recap the needle using 2 hands. Option B, place the needle on the tray while labeling tubes. Option C, activate the safety device immediately and discard the needle in a sharps container. Option D, carry the used needle to the desk for later disposal. The correct answer is option C, activate the safety device immediately and discard the needle in a sharps container. Immediate safety activation and sharps disposal reduce exposure risk after collection. Carrying, recapping, or setting down used needles creates preventable injury hazards. Question 23. Which vein is often considered higher risk because it lies near nerves in the brachial artery? Option A, cephalic vein. Option B, dorsal metacarpal vein. Option C, median cubital vein. Option D, basilic vein. The correct answer is option D, basilic vein. The basilic area is used with caution because important nerves and arteries are nearby. Median cubital, dorsal hand, and cephalic sites may still require care but are not the classic highest risk antecubital choice. Question 24. Which specimen type is most appropriate for many point-of-care glucose tests? Option A, capillary whole blood. Option B, clotted serum only. Option C, sputum specimen. Option D, CSF specimen. The correct answer is option A, capillary whole blood. Point-of-care glucose testing commonly uses capillary whole blood obtained by fingerstick. Serum, sputum, and cerebrospinal fluid are not the usual specimen types for routine bedside glucose meter testing. Question 25. Which patient interaction shows respect for cultural differences? Option A, assume all patients from one culture want the same approach. Option B, ask open-ended questions about preferences that may affect care. Option C, use family members for interpretation in every situation. Option D, ignore religious or modesty concerns during collection. The correct answer is option B, ask open-ended questions about preferences that may affect care. Open-ended questions help identify individual preferences without stereotyping. Assumptions, ignoring concerns, and relying automatically on family interpreters can compromise respectful and accurate care. Question 26. Which statement about tube expiration dates is accurate? Option A, expiration dates matter only for blood culture bottles. Option B, expired tubes can be used if the patient is fasting. Option C, expired tubes may have reduced vacuum or additive problems and should not be used. Option D, expired tubes are safe if the stopper looks clean. The correct answer is option C, expired tubes may have reduced vacuum or additive problems and should not be used. Tube expiration affects vacuum and additive reliability, which can compromise fill volume and specimen integrity. Visual cleanliness, culture-only assumptions, and fasting status do not make expired tubes acceptable. Question 27. Which PPE is most commonly required for routine venipuncture? Option A, shoe covers. Option B, face shield for every draw. Option C, sterile gown. Option D, gloves. The correct answer is option D, gloves. Gloves provide a basic barrier against blood exposure during routine blood collection. Sterile gowns, face shields, and shoe covers may be needed for specific risks but are not the standard minimum for every routine draw. Question 28. Which instruction should be followed for tubes containing clot activator? Option A, invert according to manufacturer instructions after collection. Option B, never mix the tube under any circumstances. Option C, freeze immediately before clotting. Option D, remove the gel separator before transport. The correct answer is option A, invert according to manufacturer instructions after collection. Clot activator tubes are usually inverted gently to distribute the activator and support proper clotting. Not mixing, freezing before clotting, or removing separator material can compromise specimen processing. Question 29. In a clinical laboratory setting, which action is best when a patient asks why a test was ordered? Option A, guess based on the diagnosis listed. Option B, refer the patient to the provider for interpretation of the reason. Option C, refuse to answer and walk away. Option D, tell the patient the result will probably be abnormal. The correct answer is option B, refer the patient to the provider for interpretation of the reason. The provider is responsible for explaining diagnostic reasoning and interpreting medical necessity. Guessing, predicting abnormal results, or being dismissive can misinform the patient and undermine professionalism. Question 30. Which item is used to cleanse a routine venipuncture site for many blood collections? Option A, hand lotion. Option B, sterile saline as the only antiseptic. Option C, 70% isopropyl alcohol pad. Option D, dry cotton ball only. The correct answer is option C, 70% isopropyl alcohol pad. Alcohol pads are commonly used for routine skin antisepsis before venipuncture when blood cultures are not being collected. Dry cotton, lotion, and saline alone do not provide the same routine antiseptic action. Question 31. After a needle stick injury, which action should the phlebotomist take first? Option A, recap the needle and place it in a pocket. Option B, apply a bandage and ignore the incident if there is no bleeding. Option C, finish all remaining patient draws first. Option D, wash the area and report the exposure immediately. The correct answer is option D, wash the area and report the exposure immediately. Immediate cleansing and reporting allow timely exposure evaluation and follow-up. Delaying reporting, ignoring the injury, or recapping and pocketing a needle increases risk and violates safety practice. Question 32. A phlebotomist accidentally touches a cleaned venipuncture site before inserting the needle. Which action is best? Option A, clean the site again before proceeding. Option B, proceed because gloves are clean. Option C, blow on the site and continue. Option D, cover the touched area with tape. The correct answer is option A. Clean the site again before proceeding. Touching the prepared site can contaminate it, so the area should be cleansed again. Clean gloves are not sterile, blowing adds contamination, and tape does not disinfect the site. Question 33. Which type of specimen should be mixed by gentle inversion immediately after collection? Option A, non-additive serum tube only. Option B, anticoagulant tube specimen. Option C, sharps container contents. Option D, a blood culture bottle after incubation. The correct answer is option B, anticoagulant tube specimen. Anticoagulant tubes must be mixed promptly so blood contacts the additive evenly. Non-additive serum tubes clot instead, blood culture handling follows bottle instructions, and sharps containers are not mixed. Question 34. Which draw site should be avoided when there is extensive scarring or burns? Option A, a properly assessed dorsal hand vein. Option B, a policy-approved alternate site. Option C, the scarred or burned area. Option D, a suitable vein on the opposite arm. The correct answer is option C, the scarred or burned area. Scarred or burned tissue may have impaired circulation and can make collection painful or unreliable. Opposite arm, hand, or approved alternate sites may be suitable when assessed properly. Question 35. Which action is required when collecting a blood culture set? Option A, touch the bottle tops after disinfection to confirm dryness. Option B, collect after all additive tubes are filled. Option C, use only a lavender tube for both aerobic and anaerobic testing. Option D, use aseptic technique and follow bottle volume requirements. The correct answer is option D, use aseptic technique and follow bottle volume requirements. Blood culture accuracy depends on aseptic collection and proper blood volume in the correct bottles. Lavender tubes, late collection, and touching disinfected tops can cause contamination or invalid culture collection. Question 36. In a clinical laboratory setting, why should patients avoid pumping the fist repeatedly during venipuncture? Option A, it can alter some analyte levels such as potassium. Option B, it sterilizes the puncture site too quickly. Option C, it prevents blood from entering the tube. Option D, it replaces the need for a tourniquet. The correct answer is option A, it can alter some analyte levels such as potassium. Repeated fist pumping can cause local changes that affect certain laboratory values. It does not sterilize the skin, stop blood flow into tubes, or eliminate the need for proper vein access technique. Question 37. Why should a phlebotomist avoid drawing above an active 4 when possible? Option A, the vein will always collapse above an 4. Option B, 4 fluid can dilute or contaminate the specimen. Option C, tourniquets cannot be used on arms with IVs. Option D, a blood cannot flow above an 4 site. The correct answer is option B, 4 fluid can dilute or contaminate the specimen. 4 fluids can alter test results if the specimen is collected from an area affected by infusion. Vein collapse is not guaranteed, blood flow still occurs, and tourniquet use depends on facility policy and patient condition. Question 38. Which action helps prevent rolling veins during needle insertion? Option A, insert the needle without stabilizing the skin. Option B, ask the patient to pump the fist rapidly. Option C, anchor the vein below the puncture site. Option D, tap the needle hub repeatedly. The correct answer is option C, anchor the vein below the puncture site. Anchoring stabilizes the vein and improves the chance of smooth needle entry. Tapping the hub, failing to anchor, or rapid fist pumping does not control vein movement and may create other problems. Question 39. Which instruction fits a peak drug level collection? Option A, collect from a clotted capillary specimen. Option B, collect only after a 12-hour fast. Option C, collect any time before the next dose only. Option D, collect at the specified time after medication administration. The correct answer is option D, collect at the specified time after medication administration. Peak levels measure the highest expected drug concentration at a defined time after dosing. Trough timing, fasting, and clotted capillary collection do not describe standard peak level timing. Question 40. Which specimen issue can be caused by leaving a tourniquet on too long? Option A, hemoconcentration. Option B, hemodilution from fluid only. Option C, sterile contamination. Option D, loss of tube vacuum. The correct answer is option A, hemoconcentration. Prolonged tourniquet pressure can concentrate blood components and alter certain test values. For dilution, microbial contamination, and tube vacuum loss have different causes. Question 41. Which action is appropriate if a patient has had a mastectomy on one side? Option A. Always draw from the affected side first. Option B. Follow facility policy and avoid the affected side unless approved. Option C. Apply a tourniquet tightly over the surgical side. Option D. Ignore the history if veins are visible. The correct answer is option B. Follow facility policy and avoid the affected side unless approved. Mastectomy history can affect lymphatic drainage and infection risk, so site selection should follow policy and provider guidance. Automatically using the affected side, ignoring history, or applying tight pressure there may increase complications. Question 42. Which patient statement suggests the phlebotomist should check for latex allergy precautions? Option A. I drank water before my test. Option B. I am nervous around needles. Option C. Latex gloves make my skin swell and itch. Option D. I prefer my blood drawn from the left arm. The correct answer is option C. Latex gloves make my skin swell and itch. A history of swelling and itching from latex suggests possible allergy and requires latex-safe supplies according to policy. Arm preference, hydration, and needle anxiety are important but do not specifically indicate latex sensitivity. Question 43. In a clinical laboratory setting, a phlebotomist cleans a venipuncture site for a blood culture. Which practice is most appropriate? Option A. Wipe the site dry with clean gauze immediately. Option B. Palpate the vein again without sterile technique. Option C. Blow gently on the site to speed drying. Option D. Allow the antiseptic to air dry completely. The correct answer is option D. Allow the antiseptic to air dry completely. Antiseptic must air dry so it can work effectively and so skin organisms are less likely to contaminate the specimen. Blowing, repalpating without proper technique, or wiping away the antiseptic can reintroduce microorganisms and compromise the culture. Question 44. Which step is part of verifying a laboratory requisition? Option A. Confirm the ordered tests and patient identifiers match the patient. Option B. Ignore the requisition if tubes are already available. Option C. Collect extra tubes for any possible test. Option D. Use only the patient's room number to match the order. The correct answer is option A. Confirm the ordered tests and patient identifiers match the patient. Reviewing the requisition helps ensure the right patient, tests, and collection requirements are followed. Ignoring orders, collecting unnecessary specimens, or relying on room number alone increases errors. Question 45. Which action should occur before putting on gloves for venipuncture? Option A. Open all tubes and remove stoppers. Option B. Perform hand hygiene. Option C. Label specimens in advance. Option D. Apply the tourniquet for several minutes. The correct answer is option B. Perform hand hygiene. Hand hygiene before gloving reduces transmission risk and supports infection control. Opening tubes, prolonged tourniquet use, and prelabeling specimens are inappropriate or unsafe steps. Question 46. Which action is correct when collecting from a patient in isolation? Option A. Take extra supplies into the room and return unused items to the cart. Option B. Remove PPE in the hallway before leaving the room. Option C. Follow posted precautions and use required PPE before entering. Option D. Enter quickly without PPE if the draw is brief. The correct answer is option C. Follow posted precautions and use required PPE before entering. Isolation procedures protect the patient, staff, and environment from transmission. Skipping PPE, returning potentially contaminated supplies, or removing PPE in the wrong area can spread contamination. Question 47. Which agency standard is most directly associated with workplace protection from bloodborne pathogens? Option A. CMS Patient Billing Rule. Option B. FDA Food Labeling Regulation. Option C, HIPAA Privacy Rule. Option D, OSHA Bloodborne Pathogens Standard. The correct answer is option D, OSHA Bloodborne Pathogens Standard. OSHA standards address occupational exposure risks and require controls such as PPE, training, and exposure plans. HIPAA focuses on privacy, while FDA food rules and billing rules do not govern routine needle stick exposure protection. Question 48. Which statement about sharps containers is accurate? Option A. They should be puncture resistant and closable. Option B. They may be emptied by hand when full. Option C. They should be filled above the marked fill line. Option D. They are used only for glass tubes and not needles. The correct answer is option A. They should be puncture resistant and closable. Sharps containers are designed to contain contaminated sharp devices safely until disposal. Manual emptying, overfilling, and excluding needles from sharps disposal are unsafe practices. Question 49. Which action is appropriate when a hematoma begins to form during venipuncture? Option A. Continue drawing because the tube is nearly full. Option B. Release the tourniquet, remove the needle, and apply pressure. Option C. Insert the needle deeper through the swelling. Option D. Massage the swelling to disperse the blood. The correct answer is option B. Release the tourniquet, remove the needle, and apply pressure. A forming hematoma indicates blood is leaking into tissue, so the draw should stop and pressure should be applied. Continuing, massaging, or probing can worsen tissue injury and patient discomfort. Question 50. In a clinical laboratory setting, which instruction is most appropriate after applying a bandage following venipuncture? Option A. Lift heavy objects right away with the drawn arm. Option B. Bend the elbow tightly for several minutes. Option C. Keep pressure on the site until bleeding stops and leave the bandage on briefly. Option D. Remove the bandage immediately and scratch the site if itchy. The correct answer is option C. Keep pressure on the site until bleeding stops and leave the bandage on briefly. Maintaining pressure helps prevent bleeding and bruising after the needle is removed. Immediate bandage removal, heavy lifting, and bending the elbow tightly can increase bruising or disrupt clot formation. Question 51. Which factor can cause a falsely low glucose result if processing is delayed? Option A. Labeling the tube at bedside. Option B. Using a tourniquet for less than 1 minute. Option C. Excessive patient hydration only. Option D. Glycolysis by blood cells. The correct answer is option D. Glycolysis by blood cells. Cells continue using glucose after collection, so delayed processing can lower measured glucose unless preserved appropriately. Hydration, proper tourniquet timing, and bedside labeling are not the main cause of delayed glucose decline. Question 52. Which professional behavior is appropriate when entering a patient's room? Option A. Introduce yourself and explain the procedure briefly. Option B. Begin setting up without speaking. Option C. Discuss another patient's results with the patient. Option D. Ignore patient questions to save time. The correct answer is option A. Introduce yourself and explain the procedure briefly. A clear introduction and brief explanation support patient trust, cooperation, and informed participation. Silence, unrelated patient information, and ignoring questions are unprofessional and may violate privacy or communication standards. Question 53. Which test is most affected by underfilling a light blue top tube? Option A. Complete blood count. Option B. Prothrombin time. Option C. Serum cholesterol. Option D. A blood culture gram stain. The correct answer is option B. Prothrombin time. Coagulation testing requires an accurate citrate to blood ratio, so underfilling can alter clotting results. CBC, blood culture, and serum cholesterol specimens have different collection requirements and are not affected by the same citrate ratio issue. Question 54. Which sample problem is most associated with delayed separation of serum from cells? Option A. Needle gauge contamination. Option B. Patient identity mismatch automatically. Option C. Analyte changes from continued cellular metabolism. Option D. Immediate legal chain of custody failure. The correct answer is option C. Analyte changes from continued cellular metabolism. Cells continue to metabolize substances after collection, which can change results if processing is delayed. Chain of custody, needle gauge, and identity mismatch are separate issues not caused simply by delayed serum separation. Question 55. Which action is most appropriate if a patient does not speak the phlebotomist's language? Option A. Proceed without explanation if the order is clear. Option B. Ask a child in the room to interpret medical information. Option C. Speak louder until the patient nods. Option D. Use an approved interpreter according to policy. The correct answer is option D. Use an approved interpreter according to policy. Approved interpreters support accurate communication and informed cooperation. Speaking louder, using children, or skipping explanation can create misunderstandings and ethical concerns. Question 56. Which action is correct when using a lancet for capillary puncture? Option A. Use a puncture device appropriate for the patient's age and site. Option B. Reuse the lancet for the same patient if more blood is needed. Option C. Puncture parallel to fingerprint lines on an adult finger. Option D. Choose the thumb as the preferred finger stick site. The correct answer is option A. Use a puncture device appropriate for the patient's age and site. Lancets must match patient age and puncture site to reduce injury and obtain an adequate specimen. Lancets are single-use, adult finger punctures are usually across fingerprint lines, and the thumb is generally avoided. Question 57. In a clinical laboratory setting, during outpatient registration, which action best confirms a patient's identity before venipuncture? Option A. Use the room number listed on the schedule. Option B. Ask the patient to state their full name and date of birth. Option C. Compare only the patient's first name with the requisition. Option D. Ask a family member to point to the patient. The correct answer is option B. Ask the patient to state their full name and date of birth. Active identification using two identifiers reduces wrong patient collection errors before blood is drawn. Room numbers, family confirmation, and first name matching are not reliable because they can be inaccurate or shared by more than one patient. Question 58. Which patient is at greatest risk for complications from prolonged tourniquet application? Option A. A patient whose sleeve is rolled above the elbow. Option B. A patient who confirms name and date of birth. Option C. A patient whose tourniquet remains on for more than 1 minute. Option D. A patient who is seated during the draw. The correct answer is option C. A patient whose tourniquet remains on for more than 1 minute. Prolonged tourniquet time can cause hemoconcentration and affect analyte values. Seating, sleeve position, and proper identification are routine practices and do not create the same specimen quality risk. Question 59. Which additive is found in a lavender top tube used for many hematology tests? Option A. Sodium fluoride. Option B. Lithium heparin. Option C. Sodium citrate. Option D. EDTA. The correct answer is option D. EDTA. EDTA preserves cellular morphology and is commonly used for hematology testing such as complete blood counts. Citrate is used mainly for coagulation, heparin is often used for plasma chemistry, and fluoride helps preserve glucose. Question 60. Which specimen is likely compromised if a serum tube is centrifuged before clotting is complete? Option A. Serum chemistry specimen. Option B. Whole blood CBC specimen. Option C. Blood culture bottle. Option D. Light blue coagulation specimen. The correct answer is option A. Serum chemistry specimen. Serum tubes must clot before centrifugation to prevent fibrin formation and poor specimen quality. CBC, blood culture, and coagulation specimens are handled according to different anticoagulated or culture-specific requirements. Question 61. A patient begins to feel faint during venipuncture. Which action should the phlebotomist take first? Option A. Finish filling the tube quickly. Option B. Remove the needle and protect the patient from injury. Option C. Leave the needle in place while calling the provider. Option D. Ask the patient to stand and walk slowly. The correct answer is option B. Remove the needle and protect the patient from injury. Safety is the priority when syncope occurs, so the needle should be removed and the patient protected from falling or injury. Continuing the draw, making the patient stand, or leaving the needle in place increases the risk of harm. Question 62. Which action is safest when selecting a venipuncture site near a nerve complaint? Option A. Redirect the needle toward the pain. Option B. Ask the patient to ignore tingling until the tube fills. Option C. Stop and choose another suitable site if the patient reports sharp radiating pain. Option D, continue because nerve pain is expected. The correct answer is option C. Stop and choose another suitable site if the patient reports sharp radiating pain. Sharp radiating pain may indicate nerve contact, so the attempt should stop to prevent injury. Continuing, redirecting toward pain, or dismissing tingling can worsen nerve trauma. Question 63. Which action should occur after the last tube is filled but before needle removal? Option A. Dispose of the tube holder in regular trash. Option B. Label the tubes away from the patient. Option C. Ask the patient to stand. Option D. Release the tourniquet. The correct answer is option D. Release the tourniquet. Releasing the tourniquet before needle removal reduces pressure and helps limit bleeding or hematoma formation. Standing, delayed labeling, and improper disposal are not appropriate steps at that point. Question 64. In a clinical laboratory setting, which statement best describes standard precautions? Option A. Treat all blood and certain body fluids as potentially infectious. Option B. Use gloves only when a patient appears ill. Option C. Apply precautions only for patients with known infections. Option D. Skip hand hygiene if gloves were worn. The correct answer is option A. Treat all blood and certain body fluids as potentially infectious. Standard precautions assume potential infectious risk for blood and certain body fluids from every patient. Visible illness, known infection status, and glove use do not replace consistent precautions and hand hygiene. Question 65. Which test may require a trough specimen? Option A. Routine blood typing. Option B. Therapeutic drug monitoring. Option C. Random cholesterol screening. Option D. Standard CBC without medication monitoring. The correct answer is option B. Therapeutic drug monitoring. Trough levels are collected just before the next dose to evaluate the lowest drug concentration. Blood typing, CBC, and random cholesterol testing are not typically timed as medication troughs. Question 66. Which action is best when a patient has a seizure during collection? Option A. Place an object in the patient's mouth. Option B. Continue collecting because movement will stop soon. Option C. Remove the needle if possible and protect the patient from injury while calling for help. Option D. Hold the patient down forcefully. The correct answer is option C. Remove the needle if possible and protect the patient from injury while calling for help. During a seizure, preventing injury and getting help are priorities, and the needle should be removed when safe. Forceful restraint, putting objects in the mouth, or continuing the draw can cause serious harm. Question 67. Which factor most directly affects the accuracy of a citrate tube for coagulation testing? Option A. Number of gloves in the box. Option B. Tube label color brightness. Option C. Patient's favorite arm. Option D. Proper fill volume. The correct answer is option D. Proper fill volume. Citrate tubes require a specific blood-to-anticoagulant ratio for valid coagulation results. Arm preference, label brightness, and glove supply do not determine the citrate ratio. Question 68. Which finding indicates arterial puncture may have occurred during venipuncture? Option A. Bright red blood that pulses into the tube. Option B. Dark blood flowing steadily. Option C. A vein that rolls away from the needle. Option D. A tube that stops filling early. The correct answer is option A. Bright red blood that pulses into the tube. Pulsing bright red blood can indicate arterial access, which requires stopping the draw and applying firm pressure per policy. Dark steady venous blood, rolling veins, and tube vacuum issues do not specifically indicate arterial puncture. Question 69. Which information must be included on a properly labeled blood specimen? Option A. Patient diagnosis and insurance number only. Option B. Patient identifiers, collection date and time, and collector identification. Option C. Test price and billing code only. Option D. Room number and provider's initials only. The correct answer is option B. Patient identifiers, collection date and time, and collector identification. Specimen labels must support accurate identification and traceability from collection through testing. Diagnosis, insurance, room number, pricing, or billing codes do not replace required patient and collection identifiers. Question 70. Which collection method is most appropriate for a difficult small vein when a standard evacuated tube needle may collapse it? Option A. Repeated probing with the same needle. Option B, drawing below a hematoma. Option C, winged infusion set with appropriate technique. Option D, large bore needle with strong suction. The correct answer is option C, winged infusion set with appropriate technique. A winged infusion set can offer better control for small or fragile veins. Large needles and strong suction can damage veins, while probing or using a hematoma site increases complications and poor specimen quality. Question 71. In a clinical laboratory setting, which action helps produce a better capillary specimen without hemolysis? Option A, use a cold site to slow blood flow. Option B, scrape blood from the skin surface repeatedly. Option C, squeeze the puncture site forcefully. Option D, warm the site when appropriate and allow blood to flow freely. The correct answer is option D, warm the site when appropriate and allow blood to flow freely. Warming improves blood flow and reduces the need for excessive pressure that can damage cells or dilute the sample. Forceful squeezing, scraping, and using a cold site can lead to hemolysis, clotting, or poor specimen quality. Question 72. Which patient condition may make capillary puncture preferable to venipuncture? Option A, very small or difficult veins when only a small sample is needed. Option B, an order requiring multiple large volume tubes. Option C, blood culture collection requiring strict volume. Option D, coagulation testing needing a full citrate tube. The correct answer is option A, very small or difficult veins when only a small sample is needed. Capillary puncture can be useful when only a small specimen is needed and venous access is difficult. Large volume testing, blood cultures, and full citrate coagulation specimens generally require venipuncture or specific collection methods. Question 73. Before drawing a coagulation specimen, which tube should the phlebotomist select? Option A, red top tube. Option B, light blue top tube. Option C, black top tube. Option D, green top tube. The correct answer is option B, light blue top tube. Light blue tubes contain sodium citrate and are designed for coagulation studies that require a specific blood-to-additive ratio. Red, green, and black tubes serve different testing purposes and do not provide the standard citrate ratio needed for routine coagulation testing. Question 74. Which condition makes a specimen more likely to be hemolyzed? Option A, gently inverting additive tubes. Option B, releasing the tourniquet on time. Option C, using a needle that is too small for the collection. Option D, allowing antiseptic to dry fully. The correct answer is option C, using a needle that is too small for the collection. A very small needle can create shear stress that damages red blood cells during collection. Dry antiseptic, gentle inversion, and timely tourniquet release support proper collection technique. Question 75. Which angle is commonly appropriate for routine antecubital venipuncture? Option A, straight downward at 90 degrees for all patients. Option B, a flat against the skin at 0 degrees. Option C, about 60 to 90 degrees. Option D, about 15 to 30 degrees. The correct answer is option D, about 15 to 30 degrees. A 15 to 30 degree angle is commonly used to enter a superficial antecubital vein safely. Steeper or flat angles can miss the vein, pass through it, or increase tissue trauma. Question 76. Which order of draw sequence is most appropriate for routine venipuncture? Option A, blood cultures, light blue, serum, green, lavender, gray. Option B, lavender, gray, green, serum, light blue, blood cultures. Option C, gray, lavender, serum, blood cultures, light blue, green. Option D, serum, blood cultures, lavender, light blue, gray, green. The correct answer is option A, blood cultures, light blue, serum, green, lavender, gray. The standard order of draw is designed to reduce additive carryover and protect test accuracy. Collecting EDTA, fluoride, or serum tubes out of sequence can contaminate later specimens and alter results. Question 77. Which department commonly performs a complete blood count? Option A, microbiology. Option B, hematology. Option C, histology. Option D, immunohematology only. The correct answer is option B, hematology. CBC testing evaluates blood cells and is performed in hematology. Microbiology focuses on organisms, immunohematology focuses on blood bank testing, and histology studies tissues. Question 78. In a clinical laboratory setting, which patient is most likely to require extra care for fragile veins? Option A. A young adult with no medical history. Option B. A patient drinking water in the waiting area. Option C. An older adult with thin skin. Option D. A healthy adult athlete. The correct answer is option C. An older adult with thin skin. Older adults may have fragile veins in skin, requiring careful site selection and gentle technique. Athletic, young, or hydrated patients may still require proper care but are not the classic fragile vein risk group. Question 79. Which action is correct if a patient asks for test results during collection? Option A. Promise the result will be normal. Option B. Give results from another patient's chart as an example. Option C. Tell the patient the expected result based on appearance of blood. Option D. Explain that results must be obtained from the provider or authorized reporting process. The correct answer is option D. Explain that results must be obtained from the provider or authorized reporting process. Phlebotomists generally do not interpret or release results outside approved procedures. Guessing, sharing another chart, or promising results is inaccurate and may violate privacy or professional boundaries. Question 80. For routine venipuncture, which vein is usually the first choice in the antecubital area? Option A. Median cubital vein. Option B. Basilic vein. Option C. Dorsal hand vein. Option D. Cephalic vein near the wrist. The correct answer is option A. Median cubital vein. The median cubital vein is commonly preferred because it is usually well anchored and less near major nerves or arteries. The basilic vein has higher risk because of nearby structures, and hand or wrist sites are usually alternatives rather than first choice. Question 81. Which tube is commonly associated with blood bank testing such as type and screen? Option A. Gray top fluoride tube. Option B. Pink top EDTA tube. Option C. Green top heparin tube. Option D. Light blue citrate tube. The correct answer is option B. Pink top EDTA tube. Pink EDTA tubes are commonly used for blood bank testing because they preserve cells for compatibility-related testing. Fluoride, citrate, and heparin tubes are used for other laboratory purposes and are not the standard blood bank tube choice in many systems. Question 82. A patient refuses a blood draw after the test is explained. Which response is most appropriate? Option A. Ask another patient to convince them. Option B. Document that the patient was unavailable without reporting the refusal. Option C. Respect the refusal and notify the appropriate healthcare professional. Option D. Force the draw because the order is in the chart. The correct answer is option C. Respect the refusal and notify the appropriate healthcare professional. Patients have the right to refuse procedures, and the refusal should be documented and communicated according to policy. Forcing a draw, relying on another patient, or misdocumenting the situation is unethical and unsafe. Question 83. A lavender top tube is drawn before a potassium chemistry tube by mistake. Which problem may occur? Option A. Delayed clot formation from sodium fluoride. Option B. Contaminated blood culture bottles from serum gel. Option C. Falsely decreased glucose from citrate carryover. Option D. Falsely elevated potassium from EDTA carryover. The correct answer is option D. Falsely elevated potassium from EDTA carryover. EDTA contains potassium salts in many tubes, so carryover can falsely increase potassium results in chemistry testing. Citrate, serum gel, and fluoride are not the main concern in this specific sequence error. Question 84. Which action best reduces the risk of specimen mislabeling? Option A. Label the tube at the patient's side immediately after collection. Option B. Label tubes before entering the patient room. Option C. Take unlabeled tubes to the lab for batch labeling. Option D. Ask a coworker to label tubes later from memory. The correct answer is option A. Label the tube at the patient's side immediately after collection. Bedside labeling immediately after collection links the specimen to the correct patient and collection event. Pre-labeling, delayed labeling, and memory-based labeling increase the chance of wrong patient errors. Question 85. In a clinical laboratory setting, which specimen is most likely to require chain of custody documentation? Option A. Routine cholesterol screening. Option B. Legal blood alcohol test. Option C. Basic metabolic panel. Option D. Complete blood count. The correct answer is option B. Legal blood alcohol test. Chain of custody documents specimen handling when results may be used in legal or forensic settings. Routine chemistry and hematology tests require accurate labeling but usually do not require legal chain of custody tracking. Question 86. Which blood component is primarily affected by clotting in a lavender top CBC specimen? Option A. Serum separator gel position. Option B. Legal custody seal integrity. Option C. Cell count accuracy. Option D. Culture bottle atmosphere. The correct answer is option C. Cell count accuracy. Clots in an anticoagulated CBC specimen can trap cells and make cell counts inaccurate. Culture atmosphere, gel position, and custody seals are unrelated to clotting in an EDTA CBC tube. Question 87. Which test commonly requires protection from light after collection? Option A. Blood urea nitrogen. Option B. Chloride. Option C. Sodium. Option D. Bilirubin. The correct answer is option D. Bilirubin. Bilirubin is light sensitive, so specimens are commonly protected to prevent analyte degradation. Sodium, chloride, and BUN are not the classic routine examples requiring light protection after collection. Question 88. Which tube is typically collected first when blood cultures are ordered with other laboratory tests? Option A. Blood culture bottles. Option B. Lavender top tube. Option C. Serum separator tube. Option D. Gray top tube. The correct answer is option A. Blood culture bottles. Blood cultures are collected first to reduce contamination and additive carryover into microbiology specimens. EDTA, serum gel, and glycolytic inhibitor tubes are collected later because their additives can interfere with culture results if carried over. Question 89. Which tube should be inverted rather than shaken after collection? Option A. Plain glass red top tube with no additive. Option B. Lavender top EDTA tube. Option C. Sharps container. Option D. Urine culture cup. The correct answer is option B. Lavender top EDTA tube. Additive blood tubes such as EDTA tubes require gentle inversion to mix blood and additive without damaging cells. Plain non-additive tubes, urine cups, and Sharps containers do not require the same blood additive mixing process. Question 90. Which patient preparation detail is most important for a lipid panel when fasting is required by the order? Option A. Tell the patient to eat immediately before collection. Option B. Ignore fasting because all lipid tests are random. Option C. Confirm the fasting status before drawing. Option D. Ask the patient to exercise during the draw. The correct answer is option C. Confirm the fasting status before drawing. When fasting is required, confirmation helps ensure the specimen matches test conditions. Exercise during collection, eating beforehand, or ignoring the order can affect interpretation. Question 91. Which factor is a pre-analytical variable? Option A. Insurance claim submission. Option B. Provider diagnosis after results report. Option C. Analyzer calibration after the specimen arrives. Option D. Specimen collection technique. The correct answer is option D. Specimen collection technique. Pre-analytical variables occur before analysis and include patient preparation, collection, labeling, handling, and transport. Analyzer calibration is analytical, while diagnosis and billing occur outside the collection phase. Question 92. In a clinical laboratory setting, which item is appropriate for warming a venipuncture site? Option A. A facility-approved warm compress. Option B. A microwave-heated wet towel without temperature check. Option C. An open flame held near the arm. Option D. Very hot water applied directly to skin. The correct answer is option A. A facility-approved warm compress. Approved warm compresses can improve circulation while reducing burn risk. Uncontrolled heat sources, open flames, and very hot water can injure the patient. Question 93. A fasting glucose specimen is ordered. Which patient statement requires follow-up before collection? Option A. I have not eaten since last night. Option B. I drank sweetened coffee this morning. Option C. My provider told me to fast for the test. Option D. I only had water before coming in. The correct answer is option B. I drank sweetened coffee this morning. Sweetened coffee can affect glucose results and may mean the fasting requirement was not met. Not eating, drinking water only, and following provider fasting instructions are consistent with typical fasting collection requirements. Question 94. Which area is inappropriate for adult fingerstick collection? Option A. The side of the ring finger pad. Option B. A warm, well-perfused puncture site. Option C. The very tip or center of the finger pad. Option D. The side of the middle finger pad. The correct answer is option C. The very tip or center of the finger pad. The very tip or center can be more painful and may be closer to bone or nerve endings. The side of the middle or ring finger pad is commonly preferred when warm and well perfused. Question 95. Which action is required immediately after filling an additive tube? Option A. Remove the stopper to release pressure. Option B. Shake the tube until bubbles appear. Option C. Place the tube upright without mixing. Option D. Gently invert the tube the recommended number of times. The correct answer is option D. Gently invert the tube the recommended number of times. Gentle inversion mixes blood with the additive to prevent clotting or preserve the specimen as intended. Not mixing can cause clots, shaking can damage cells, and removing the stopper can expose the specimen and increase contamination risk. Question 96. Which tube additive prevents clotting by binding calcium for coagulation studies? Option A. Sodium citrate. Option B. EDTA for hematology only. Option C. Thrombin. Option D. Sodium fluoride only. The correct answer is option A. Sodium citrate. Sodium citrate binds calcium reversibly and preserves the specimen for coagulation testing when the tube is properly filled. EDTA is not used for routine coagulation testing. Thrombin promotes clotting, and fluoride is mainly used to inhibit glycolysis. Question 97. Which site should generally be avoided for venipuncture? Option A. The median cubital vein on a suitable arm. Option B. An arm with a dialysis fistula unless specifically approved. Option C. The opposite arm from and for when accessible. Option D. A hand vein when antecubital veins are unavailable. The correct answer is option B. An arm with a dialysis fistula unless specifically approved. A dialysis fistula arm should be protected because puncture can damage access and increase complications. Suitable antecubital, hand, or opposite arm sites may be used when appropriate and permitted by policy. Question 98. Which specimen should be transported at body temperature when required by protocol? Option A. Standard serum sodium specimen. Option B. Urine pregnancy test specimen. Option C. Cold agglutinin specimen. Option D. Routine CBC specimen. The correct answer is option C. Cold agglutinin specimen. Cold agglutinin specimens may require warmth to prevent temperature-related changes before testing. Routine CBC, sodium, and urine pregnancy specimens do not typically require body temperature transport. Question 99. In a clinical laboratory setting, which color tube is commonly used for glucose testing because it contains an antiglycolytic additive? Option A. Tan top. Option B. Yellow SBS top. Option C. Royal blue top. Option D. Gray top. The correct answer is option D. Gray top. Gray tubes commonly contain sodium fluoride with an anticoagulant to help preserve glucose by slowing glycolysis. Royal blue, SBS yellow, and tan tubes serve different specialized testing purposes. Question 100. Which quality assurance practice helps track collection errors? Option A. Documenting specimen rejection reasons and corrective actions. Option B. Ignoring rejected specimens once recollected. Option C. Changing labels after specimens arrive in the lab. Option D. Using undocumented shortcuts to save time. The correct answer is option A. Documenting specimen rejection reasons and corrective actions. Tracking rejections and corrective actions supports quality improvement and error prevention. Ignoring problems, relabelling later, and undocumented shortcuts hide errors and weaken patient safety systems.